lines along the eye, cheek. So these are expression lines. And the most common lines that we see, especially in the West, due to sun damage. Photo damage causes, the sun causes a lot of damage to your skin. Sun is very beneficial for us. It is important. We cannot live without sun. We need sunlight for vitamin D. We use sunlight for many medical treatments. But you must know when and how to use the sunlight. If you are overexposed to sunlight, it does. Okay. So let's go to the next. The effect of UV light. Now with global warming, ozone layer clearing up, we get more sun rays coming to the surface of the earth. So the more UV lights, we have UVA, UVB, UVC, D, etc. But the UVB lights are the lights that we use for treatment, but the other range of UV lights causes a lot of damage to the skin. And the peak hours that you get UV light is 10 a.m. to 2 p.m. Please recite after me, 10 a.m. to 2 p.m. Never expose your skin to the sun directly. Right? This is the time when you must apply sunscreen, right? Wear hats, wear umbrella, sunglasses, and cover your body with protective clothing. Can I have a remote that I can pointer? If you have any pointer? Right. So you see in the picture, this lady is wearing a hat and an umbrella. Don't laugh at her. And don't be shy. Don't think that what will people think of me if I wear a hat and still an umbrella. Don't care, because it's your skin, not their skin. Yes. Go ahead, wear a cap, a hat. And for this lady, a scarf, a hat also. And look at her arm, she covered herself. That is the right way. And the other picture, especially more Chinese people are getting very aware of the damage. The fairer you are, the lesser UV protection you have. So you need to use multiple layers of protective clothing. So don't be shy. I have a prominent dermatologist, skin specialist from America visiting me to give a lecture at my hospital. So we parked the car, near the university, and from the car park, just to go to the corridor, to the room, maybe here to the end. He put on a hat, he put on sunglasses, just to go there. So how skin specialists are so scared of UV light, right? To take care of your skin. Next slide. Right, so what can sun damage do to your skin? How bad, right? Sun exposure, if it is very high, you have to use sunscreen. At least sun protection factor more than 30. You can see when you buy shoes, you read SPF, at least 30 that you buy. It has to be 40, you have above 50 also. The higher protection you get, the better for you, right? And photo-damaged skin, this is what it looks like. When you were young, when your mother gave birth to you, you have a beautiful baby skin. But as you grow old, you started seeing lines and dots and spots on your skin. These are due to sun-damaged skin. And as you look older, early aging, right? And these sun exposure, if it just gives you line or just pigment, it's not so bad. But long-term exposure, right, nothing coming up. Maybe I have yeah, but apart from this, the most dangerous part is skin cancer. So people with fairer skin, blue eyes, blonde hair, you have to be very careful. because you are prone to skin cancer, right? But having said that, in Asia also we are still seeing some Asian people also have fairer skin compared to darker one. They are also having more and more skin cancer. And because of the awareness, we are seeing more skin cancer in Asian people also. So if you go to Australia, England, America, people are so sick of being in the cold. They like to have, go out into the beach. They will relax on the beach bench, and then they will have sunbathing, sun tanning. But previously they never cover with sunblock. Nowadays they do take care. So if you don't have sunblock, sunscreen, not only you get all the pigments and lines, but you can get skin cancer, which is very dangerous. Next slide. Or I can control it. Right, so how do we maintain our skin? We don't want that picture, we don't want those pigments, we don't want those lines. How do we maintain it? The first thing is you need very good skin care. Simple but good skin care. That is very, very important. Wash your face, use a proper facial wash that will really clean up all the makeup or the powder that you have applied the day before. So every night and every morning, you need to use a good skin wash, right? Facial wash to do that. And after facial wash, you need to use vitamin C serum. Vitamin C is what we eat all the time. It's good to prevent viral infection, it's good for absorption. But sometimes oral alone is not going to help. Because for the skin, for the face, you need to apply vitamin C serum, which is very expensive. And I have here in the bag prices, vitamin C serum, okay? What does it do? It is an antioxidant, all right? It smoothens your skin, remove the pigments, and prevent, other types of line appearing. So vitamin C is very, very useful. It's organic, it's natural. Having said that, don't go and apply line on your face, okay? We say, oh, vitamin C serum is too expensive. I cannot afford. I will cut the line and just put 2 slices on my face and go to bed. No, that has acid, lime, Lime has acid in it. And if you put that on your face, you will burn your face. So we have many patients coming to the clinic, coming with burn marks, right? So we ask them, what did you do? Oh, I saw on the internet that vitamin C is good, and I cannot buy vitamin C, so I cut the lime and I put on my face. So the natural vitamin C has acid. The serum that you buy from the shops, from the clinic, we remove that acid on it. So there's no acid in it, you can apply, right? Don't use orange or lime direct on your face, okay? You will burn and make it worse. Understand? Yeah. So after that, moisturizer. Your skin gets drier and drier, number 1, when you grow old, right? Number 2, when you are exposed to sun. Number 3, when you are in this kind of environment, air conditioned the whole day and night. So it gets dry. And when you get dry skin, whether young or old, older people as well, become very itchy. Dry skin causes itchiness. So sometimes if you feel itchy, look at your skin. Is your skin very dry? Apply moisturizer, right? Don't think of allergy or don't think of insect bite first. Think carefully. And my mom, when she was like 92, she started having rashes, the back and the front, and the maid was very concerned. Called me and asked me, what must I do? Mom is having all the rashes. So I just gave her a simple answer, apply moisturizer all over her body. And that took care of all the itchiness and rashes. So moisturizing your whole body and your face is very important. You need moisture. So all you need is a facial wash, vitamin C, and moisturizer. These are the 3 components that you cannot go without. You need that very much, all right? And skin resurfacing, once the damage is done, okay, I didn't know, I went out into the sun without protecting my skin, Now I need to correct that. What should I do? There are many procedures. We call it chemical peeling. This time we use a doctor-grade acid that we can put on your face, and then we just leave it for 2 minutes, and then we remove it, and we apply moisturizer back. Once a week, if you do that, all the pigments, all the lines disappear. We call it chemical peeling, and sometimes we do physical peeling, something more serious than that. We use a bit more stronger acid, and nowadays lasers and lights. We use lasers to peel off, carbon lasers to peel off. You'll see it like next time. So there are many procedures, but make sure you go to a qualified doctor to do this procedure. Don't go to any beauty shop. Don't go to a friend who knows how to do this. Don't watch YouTube and do it, all right? Go to a doctor so that your face, which is very precious, will be taken care of and you will see good results, all right? And skin remodeling, it's sagging. We don't like our skin to be sad. We don't like to have lines here. We don't like to have lines on our forehead. It can be corrected, but of course this is artificial. People use Botox. I'm sure all of you have heard about Botox. You can remove all the lines, I don't use Botox, so I have lines here. And then you have filler injection, filler to fill up the line, to fill up the drooping area. And PRP is the latest. What we do with PRP is we draw your own blood. Very original, very organic. Just your own blood, maybe 10 cc only. And we put it in a special test tube. We turn it, centrifuge it for 5 minutes only. What it does is it separates 2 layers. Your blood will be below. On top will be stem cell growth factor. We just take your stem cell growth factor and inject back into your face. You have a glowing, beautiful, filled-up face. No more line. And the longer you keep, unlike Botox filler, the effect fades after time. But PRP, platelet-rich plasma, which is stem cell, gets better and better with each week and month, and organic. And this is the latest treatment that can be done. I can do free of charge for you, but you must get the test tube, which is very expensive. It's not an ordinary test tube. It comes from Switzerland, so let's not talk about that today. Okay, and if you want to go a little bit more than that, okay, PRP you still have to do every 6 months. I don't want to go for injection every 6 months. You can do thread lift. Nowadays they put thread into your face and lift up the sagging skin. Even your eyebrow, even your nose can go higher, sharper with thread there. That's one way. Plastic surgery is, of course, the last facelift procedure, neck procedure. But we don't need so much as long as you can take care of the skin before it turns very bad. Daily, you don't need all those big procedures because we are not models or we're not, actresses. Next slide. So what kind of skincare? In a lot of ladies, I'm sure in your cabinet, your dressing table, I believe all of you have tons of skincare, right? You don't even know where to start, what to use, you will have definitely a lot. This thing works on the floor but not on the slide. Yeah. So what I would recommend, normal cleanser, a good cleanser. A cleanser that will cleanse your face, right? It not be too strong. A cleanser is very important. People who tend to have acne at a younger age, they need to use another type of cleanser. We have salicylic acid in it that means for acne faces, acne wash, right? But for normal skin like us, we can use a good cleanser followed by a toner. Toner is to, when you wash your face after the water, your pH balance is no longer there. So just to get back your pH balance, you use toner, right? And then, but if you don't have toner also, never mind. Cleanser, vitamin C. Like what I mentioned before, you must have vitamin C, this is important, and moisturizer. Okay. People that skin already damaged, then you can help out with AHA, which is hydro acid. hydroxy acid so that you can remove the lines or the pigment. That's mild. And of course, sunblock here is very important. So out of this picture, if you ask me which is most important, I will point to the cleanser, vitamin C, and moisturizer. The most important, the three important for a lady, handbag, you have to have it all the time. And if you are going out into the sun, sunblock. And sunblock does not mean just going out in the sun. Even this kind of UV light also give us damage. So it's good to have mild sunblock even if you're in a building. Right? So the peeling that I was talking about, this is called chemical peel. You use acid on the brush, safe enough that you can use with a brush, and you do it in a clinic. And this is what we talk about Botox. This lady has frown lines here, you see? These are all the lines. And after Botox injection, it goes away, but every 6 months. And here is the PRP that I was talking about. The stem cell, you see the blood is below, then the stem cell. This is the growth factor stem cell that we take and inject into your face. So your face becomes very glow. This is, we call it smile line, right? Nasolabial fold. Everybody has it, especially when you grow old. You can inject filler and it builds up. This is thread lift. You put thread, literally thread into your face, it lifts up the jawline so you look beautiful. So there are many, many different types of therapies to make you look beautiful. Next. Yeah, but those are what we try to do from outside. But what about internally? We do need some kind of supplement. So collagen is the supplement that we need. It's the protein in our body. But after the age of 40, it slowly drops in our body, right? It is the building block for your skin, for your muscles, for your bones, tendons, every part of your body. It is also found in your organ, your blood vessel, and intestinal lining. So if you age, your production drops, especially after 40 years, and especially after menopause. So if you look at this picture is a bit low. Normally, the skin is above, and then the dermis, you have a lot of collagen supporting the top skin. But with aging, what happens? You drop in collagen, so the support system drops. That is where your skin becomes saggy, right? So we need to take supplement to support the sagging skin so that the collagen will build up and your skin will be lifted up again. So this is something we need, just like we take vitamin A, B, C. Collagen is something all of us need. It is not just for the skin, it's also good for the bones, the hair, the nails, right? Next slide. A lady who does not take collagen here, her face will be like this, wrinkled, and saggy, whereas a person who takes collagen will fill up. So it helps. If you look at the one for your gut, for your two, for your nails and skin, joint health. So you will know I am 67 years old and I wear high heels wherever I go. I climb mountains, I climb stairs, I go round lakes and exercise. I never have any joint pain or any kind of pain because I've been taking collagen for at least 20 years, right? Ever since I turned 40. Collagen helps our physical health too, right? And it also supports weight management. It helps your heart and bone joints and also for your liver detoxification. So this is something all women need to take after the age of 40. One sachet a day, that is about 4,000 milligrams, in grams will be 4 grams. You just need to take with your coffee or tea, 1 packet a day, that's in the spoon. You can just put it dissolve easily. You will see the difference within 2 weeks. Your face will be fuller, you will look fresher, you can sleep well, you don't get tired, no more joint pain, bone pain, and your stamina, that's the difference. You have very good stamina if you take that. Okay, I'm not trying to sell anything, but next slide. This is the collagen, okay? And today, I'm going to bring you good news to you. All right? Do you know that this Abu, this current Abu, is very good at raising funds, right? And why do we need to raise funds? Why? Why are you raising funds? Maybe your day of rent donation is not enough. Is that the reason? No. Why do we raise funds? For Women Helping Women program, right? If we have more funds, we can have more women who are in need, right? If we just use the donation that we receive, not enough. We cannot do anything, okay? So we need funds. So the first year, what we did was that we sold bags, say no to plastic bags. We also advocate for against global warming, so we also put a statement, say no to plastic bag. That's the first fundraising year. And now this time, the General Assembly, we are selling scarf, right? All of you bought scarf already?
Yes.
Yeah, if you haven't bought, please go and buy. That is for Women Helping Women. Because on the day fashion show, all of us will be wearing t-shirt and scarf. And the person who wears the best scarf, who ties the scarf the best way, will get prizes. All right? So buy a scarf first, okay? And then tie it, and we will be monitoring you. Who is the best? And we'll give you the present. So what we have done, this is for next year project. I'm introducing all the leaders here. Very important. I explained why you need collagen already. And we want to give an opportunity not only for ABU, but for all your women union organization in your own country to make fundraising for your union, for your organization, for your convention. Because I'm sure your woman needs the project, needs some support, some help. So this kind of product, if you go back, bring it back and sell it in your own community or for your own convention, you will raise a lot of funds. And this is a necessity, and you have to take for the rest of your life. Because you're going older, you're never getting younger, right? You take this one, you are healthy now, and then the longer you grow, you still will need. You cannot stop, right? So this is a supplement to supplement the things that we have lost, so you will be taking for the rest of your life. So this will be our next year project. And please take note, if you see this brand without ABU logo, don't buy. It is not from ABU, okay? You must see with ABU logo, okay? This is from ABU. Because we have a factory in Bangkok that produces a lot of our skincare. And I was saying to them, you have been doing skincare for me for the past 20 years. Part of skincare is collagen. Why don't you produce for me? So I gave them the formula and they did it. So we are doing mass volume, factory price. And for 1 month supply, 30 sachet and 30 packets inside one big packet, and 31 packet a day, right? It costs to all the women here, your cost price is only US $10 a packet. Very cheap. 50 cents for 1 day's supply. You can take that and then you go back to your country and go and sell whatever price. It's none of our business, right? But ABU will get a little bit of fun from here, and you will get a little bit, and a little bit. And it will help your project, it will help your community, it will help your women, and it will help ABU. So this is going to be next year's major product launch. I'm showing you some samples of look like. Please buy, please take first. We do not have a lot of samples, we only have 8 here. First come, first serve, okay? So if you want, take it first and try it out. If you're convinced, place your order to ABU. How many you want from which country, we will send it to you. But of course, freight charges you have to pay yourself, right? So next slide. Right, so at the end of the day, if we want to wrap it up, what do we do to have a great looking skin? We have to avoid sun exposure. and we use sunblock, okay? Light moisturizer every day, avoid smoking. Smoking definitely causes aging and lines and other problems. Take supplements and take a balanced diet. Don't go on crash diet, don't avoid this, don't skip this, and you need adequate rest. You need at least 6 hours rest at our age, right? Exercise regularly is good, but on stage I say exercise is good, but I never exercise anything, right? But I walk a lot, I'm always active, I'm walking, that is my exercise, right? And reduce unnecessary stress. Stress causes a lot of wrinkles and lines on our body, right? Yeah. So let's go, next slide. Next slide, yeah. After the face, now we go to the body, right? You cannot just look beautiful. You cannot just look beautiful on your face and your skin is perfect. For your body, right? So, have you seen figures like this? Is it very common you see? Right? Yeah, all the time, all the time. This is called apple shape, right? Apple shape. When man grows old, their fats accumulated in front. The tummy looks like apple, right? So we call it beer belly apple shape. And the other one, this is called android distribution. The other woman, gynoid distribution, it looks like a pear. The top, where the breast should be, begins to sag, right? And then the tummy goes lower part. So you will see apple shape and pear shape when people grow old, both men and women. Next slide. This is what we call, right? This is the apple shape and this is the pear shape, right? This is very common. But not only does not look nice, it also causes health problems. People with this kind of figure are bound to have symptoms of metabolic syndrome, middle-age diseases, metabolic syndrome, and what is it? What is this syndrome? What does it comprise of? It comprises of obesity, overweight, high blood pressure, that means comes together. Once you're so fat, you get high blood pressure, you begin to get kidney problems, kidney stones, and also you have cholesterol high, low density cholesterol, which is not good for your health, high blood sugar also goes up, diabetes, and once your kidney or diabetes sets in, your urine pH is also low, you tend to get infection. So these figures comes together a bonus of diseases, okay? So if you don't want all these diseases, make sure you don't end up apple or pear. So we don't eat apple and pear anymore, okay? Next slide. So how do we, okay, I don't like apple shape, I don't like pear shape. How can I have a nice body? There are many ways, right? The first thing, not go on a strict diet, but calorie and diet restriction and exercise. We take care of what we eat. You know, there are a lot of nice foods around, especially now at the conference. You see cake, you see kueh, you see so many nice things. But ask yourself, I need those things. Eat what you need to eat. Protein, lots of protein, fruits, vegetables. Carbohydrate, which is rice, noodles, sugar, try to reduce it. So you have to control yourself and balanced diet with taking care of your health. Sometimes some people need some help, medication, appetite suppressor. They cannot straight away go on diet or control their food. So doctors have to help them, give them some kind of medication to suppress their appetite. That means they don't be hungry, they don't snack all the time, they don't eat chips all the time, they don't put on weight. And some clinics, they do whole body wrapping. They wrap you in a very, very cold solution, wrap you up like a mummy here, you see. And because of that cold solution that you are being wrapped for 20 minutes, your body starts to shiver, right? When you're cold, you shiver. So when you shiver, your fat burns up to give you warmth. So that is how you dissolve your fat. but I don't think you would like it also. It's cold, right? Yeah, and your metabolism increase. And nowadays, with all the lasers, you have RF, you have thermic to reduce the body fat, the tummy, with cold suction, things like that. But these are all temporary. The moment you remove your wrapping or you stop doing wrapping, you don't feel cold anymore, you can go back to your apple shape and pear shape, right? Yeah. And the moment you stop all the machines also, again, you can go back. Something more permanent, something that is more lasting is called liposuction. Let's have a look. Liposuction, right? Yeah. This picture belongs to my first patient, who is a well-known pastor in Myanmar, right? We use him as a model, because pastors go in front stage, preach, right? And from this big size pastor suddenly becomes small. The congregation asks, what happened to you? So he can advertise, oh, I went to this clinic, I went to this hospital, and they did liposuction for me, right? So why do pastors grow so big? Because of all of you. When the pastor comes, you give them to eat, you eat this, you give them present, right? You invite them to your house. So it's the congregation fault that pastors, and they cannot say no. If you invite them and you give them food, they cannot say no, so they put on weight. So this is from before liposuction, after liposuction model. But unfortunately, pastors are also not good patients. They don't listen. I have many naughty pastor patients. I have to scold them all the time. God give me a special blessing that I can scold pastors. They don't take medicine regularly. They don't follow instructions. So after 10 years, when I met him, back to this position. So I was very disappointed, and he was very shy to see me because he's so fat. And unfortunately, because of this obesity, when COVID second wave hit of syndrome, he passed away during COVID. So sad, right? Yeah. So like for the arm, some women, you want to wear nice dress, and arm is so big, you can do liposuction and big saggy fat. Next slide. Next slide. This is the amount of fats you have drawn in your body. You see? So how much fats you have accumulated in your body? See? So this is with laser you get fat and you get blood. This one without laser you get all mixed fat. So each time we can withdraw up to 4 liters of fat from your body. Just imagine 1,000 cc water bottle, the big bottle, 4 bottles in your tummy. You have been carrying it, right? Yeah. Okay. Next slide. So, beauty, health, and now body tour, and now physical health is important. I just mentioned drink a lot of water, eat a lot of protein. You need protein, vegetables and fruit. Avoid all the fast food, snacks, sugary food, donuts and cakes. And exercise, you need, even if you don't go to the gym, you walk every day, walk to school, walk to work, or get off the bus one stop earlier and walk. These are the exercises. So we need to exercise and take care of our food to get a good physical health. Next. Next slide. Next slide. It's not moving. The spiritual, we have physical health, we have. It's not moving. Any problem with your slide? Technical team. Why is your slide not moving? Okay, I'll use my own. So Because see, actually, what I wanted to say is spiritual health. And of course, this morning we heard Proverbs 31, the woman of virtue. To all of us, not only look beautiful, not only have a nice body contour, but also we have to have the virtue, woman of virtue, be humble. That is my favorite topic. Humility is very, very important. So no matter how beautiful you are, if you are not humble, people will not see you as pretty, right? And the best line that I always take from Michelle Obama is that if they go low, we go high, right? If somebody acts nasty on you, somebody say bad about you, just ignore them. Don't take the road that they take, you take the higher road. The higher road is showing forgiveness, showing humility, and reaching out to the people you want to, and give time to others. We are all very busy, and there are many people who want our attention, who want to seek counseling from us, who need help. So we have to give time. We're so busy sometimes, we forget time for our children, for our husband, for our family. Give them time, and likewise, give time to everybody. These are the spiritual health. And of course, at the end of this lecture, what's the final outcome supposed to come out, what is not showing here, is that you all will be having a beautiful skin, an elegant body, right, healthy life, a younger, fresher, and confident woman of God, right? So the final message, okay, next slide. Very important. Yes, this is the final message. Don't get sick, stay healthy. Don't get old, stay young. Don't lose shape, stay trim. You will become a beautiful and confident woman, both inside out. Thank you very much. Now, I'm going to ask questions because I'm going to give prizes. Okay? So you have to be fast. You have to get us fast if you know the answer, right? Because we have only 10 prizes. Take picture, we get prizes also. I need both Merit and Maureen to help one this side, one this side. In our body, we have many organs.
Old people should be given permission to sit and learn.
Stand up straight away. Our body has many organs. Which organ is the largest?
Skin.
Okay, two of them start.
I think I'll stand and then answer.
Right. Okay, so I mentioned sunlight is bad for us, okay? And UV light destroys our skin. Which hour of the day? Yeah.
But in India, maybe from 8 a.m. to 9
Yeah, they're all the same. So for men and women, when we grow old, what shape do we get? Give to whoever you are. Okay, the last. No more. The last question, if you can repeat after me, don't get sick. Don't get old. Don't lose shape.
May please give a hand for Dr. Farhat.
And they take a picture with us.
Okay, thank you, Dr. Farhat, for the sharing. Let us practice what we hear from here. I will read the conclusion. To be a beautiful and confident woman, we should take care of our physical health, which includes skin complexion. So we avoid sun exposure, we use skincare, we add supplements, and if you don't mind, you can buy the collagen for Abu, okay? And also for our body cancer, we can do diet, for medication, and exercise more, of course. And also we cannot forget about our spiritual health. So be humble and give time to others and yourself. And don't forget to practice, okay? And that's it for our workshop today.
Today we are selling this for $10 only.
Okay.
Only 8 packets. So close up. Don't forget to get
$10.
pay money to Maureen. Give for one, give for one. Maureen, the ladies who are taking collagen, please pay to this green lady. Yeah, 8 she has to collect. Okay. This is for Abu.
Okay, that is for our session. Now it's time for lunch. You have 1 hour for lunch, and you need to be back here at 1 p.m. We have cultural presentation here. Thank you for your attention. God bless.